Hi, my name is Rick Zradnik, and today we'll be showing you how to apply gauze dressings for the use with the Wound Pro Apex Negative Pressure Wound Therapy Pump, manufactured by Accuro Medical Products. The Wound Pro Apex Negative Pressure Wound Therapy System may promote wound healing through the drainage and removal of infectious materials and other fluids from the wound site using continuous or intermittent negative pressure. Patients with chronic, acute, traumatic, subacute, and dehisced wounds, partial thickness burns, ulcers such as diabetic or pressure, flaps, and grafts may benefit from the use of this device. Warning: the use of any Wound Pro negative pressure wound therapy system is contraindicated for use on patients with any malignancy of the wound, untreated osteomyelitis, non-enteric or unexplored fistulas, or necrotic tissue with the presence of eschar. Never use any Wound Pro wound therapy system where there are exposed blood vessels or organs. Do not place the Apex dressings over anastomosis or sutured vessels. First, make sure to debride any necrotic tissue and cleanse the wound and peri-wound area according to institution guidelines and physician's orders. Carefully apply the skin prep around the peri-wound, being careful not to get skin prep in the wound bed. Allow to dry. Cut the non-adherent petroleum gauze to the shape of the wound. Cover the entire wound bed with the gauze. Saturate one of the antimicrobial gauze sponges with saline. Wring out the excess saline and place in the wound bed. Trim the drain, flat or round, so the groove or holes are confined to the wound bed. Place it directly on top of the gauze. Do not place the drain in a fistula track. Apply a thin strip of stoma paste on the peri-wound area where the drain leaves the wound. Taper the ends of the stoma paste down to a paper-thin thickness. Lay the drain tube across the strip of stoma paste. Apply a second thin strip of stoma paste over the top of the drain tube. Press the drain tube into the stoma paste, creating a seal around the drain tube. Be sure the stoma paste is not in contact with the wound bed. Saturate additional antimicrobial gauze with saline. Wring out any excess saline. Open and fluff into the wound to completely cover the drain, and fill the wound with antimicrobial gauze to skin level. Care should be taken to ensure the gauze is restricted to the wound area and does not protrude onto the peri-wound area. Cut a piece of transparent dressing 1 to 2 inches beyond the wound border on each side. Create an airtight seal by applying the transparent dressing, starting with the side opposite the tubing. Press the dressing down firmly around the entire wound to ensure the wound environment is sealed. In this case, more coverage is better. Apply negative pressure and make sure the dressing contracts. The dressing should be firm to the touch. Monitor the dressing to ensure that the dressing maintains a vacuum or that the dressing is contracted and the volume of exudate being removed from the wound is within the physician's expectation. If exudate volumes exceed physician's expectations, notify the physician immediately for further instructions. For Accuro Medical Products, I'm Rick Zradnik. Thanks for watching this instructional video.